Today I'm visiting with Dr. Jones at Town Center Chiropractic. Sheridan, it's good to see you.
Good to see you, Tim.
You have a very unique story as to how you got involved in chiropractic. Can you tell that to
Yeah,
me?
it's unique in that I never saw a chiropractor for a back injury when I first started going. It was for a torn hamstring. So when I started going through chiropractic school, I kept that in mind when I was looking at what I wanted to specialize, and that's how I stumbled upon my specialty.
Sure.
I've kind of focused myself into specializing with a lot of different things other than the back.
Yes.
Work on the spine, of course, but extremity issues, especially things that maybe are chronic and tough to deal with a lot of times,
Sure.
are things that I like to help people out because they're very rewarding, personally for me,
Right.
to have this person come in that didn't think there was any hope.
Tell me about it.
It's called the Graston Technique. It's a soft tissue mobilization technique that uses instruments. Now, these instruments help me identify the problem areas and also are what I utilize to treat a problem.
Interesting.
A really common one that I see is plantar fasciitis. Somebody may have a tender heel. It may be tough for them to get up in the morning, walk around, exercise, do things that affect a lot of the things they like to do throughout the day. I use an instrument to try to identify any problems that might exist in the structures of the foot, and we treat that.
Okay.
That, along with some stretching and exercising, is what we use to basically heal this structure without drugs and surgery.
Now, you had a patient, doctor, who was struggling with shin splints. Tell me that story.
She was a collegiate athlete that had shin splints after her college days. Obviously very active young woman starting off a family. Thought she was going to have to live with this. We were able to successfully treat her. She was back to running within several treatments, and
Wow.
she is doing great now.
Shin splints are very painful.
Extremely, and that's the kind of pain that a lot of these chronic conditions have these patients going through. So if you or anyone you know has something like this, give us a call and we could get you in today.
Thanks.
You bet.